Hi, welcome to another episode of Medicine Simplified. In this video, we will learn about skeletal muscle relaxing drugs. Please remember, this video is only to educate medical professionals. Coming to the introduction, spasticity presents as intermittent or sustained involuntary contraction of skeletal muscle, causing stiffness that interfere with mobility and function of muscle. It is characterized by an increase in tonic stretch reflexes and flexor muscle spasm and muscle weakness. Skeletal muscle relaxants are also known as spasmolytic drugs. They act peripherally at neuromuscular junction or act centrally in cerebrospinal axis. These drugs cause muscle paralysis or reduce muscle tone. Coming to the classification of skeletal muscle relaxants, they are classified into peripherally acting and centrally acting. Following class of drugs come under centrally acting muscle relaxants. First one is methocarbamol, which include cor-isoprodol, chlorzoxazone, chlormethazone, methocarbamol. Next is benzodiazepines, which include diazepam, clonazepam, and other benzodiazepines. Next is GABA mimetics, which include baclofen, thiocolchicide. Next is central alpha agents, which include tizanidine, neural cyclobenzaprine. These are all centrally acting skeletal muscle relaxants. Coming to the peripherally acting skeletal muscle relaxants, they are subclassified into neuromuscular blockers or directly acting agents, which include dantrolene sodium and quinine, which is banned in India. Neuromuscular blockers are further classified into non-depolarizing blockers and depolarizing blockers, which include succinylcholine and dicamethonium. Non-depolarizing blockers are further classified into three groups according to their duration. First one is long-acting non-depolarizing blockers, which include the tubocuronine, atracurium, pancuronium, pipecuronium. Next one is intermediate acting, vecuronium, atracurium, cis-atracurium, rapacuronium, and rocuronium. Next is short acting, which has only one drug, that is methocarbamol. Coming to the mechanism of action, site of action of centrally acting muscle relaxant is cerebrospinal axis. Site of action of both non-depolarizing and depolarizing agent is in plate of skeletal muscle fibers. Now we will know how muscle is contracted. This is motor in plate of muscle, where ACH acetylcholine is released by axon into synaptic cleft after action potential. This ACH binds with receptor in muscle fiber, which regulates sodium channel and cause muscle contraction. Now we will know mechanism of action of non-depolarizing blockers. Non-depolarizing blockers have affinity for nicotinic receptors at muscle end plate. Nicotinic receptors are located around sodium channels. Alpha subunits of nicotinic receptors have two ACH binding sites. When ACH binds with these subunits, sodium channel opens. Non-depolarizing agents have affinity towards these receptors and bind with alpha subunits. The ACH released from motor nerve ending unable to combine with its receptor to generate in plate potential, and muscle fails to contract in response to nerve impulse. This is how non-depolarizing blockers work. Coming to the depolarizing agents, they depolarize muscle end plate by opening sodium channels for prolonged time. Initially, they produce muscle twitching. These drugs don't disassociate rapidly from receptors. which induce prolonged partial depolarization of muscle end plate, leading to inactivation of sodium channels. ACH released from motor nerve ending is unable to generate propagated muscle action potential, which results in flaccid paralysis. Coming to the indications of skeletal muscle relaxants, peripherally acting, which are used as adjuvant to general anesthesia, used in assisted ventilation in ICU. Acetylcholine is preferred in endotracheal intubation, laryngoscopy and bronchoscopy. They are used to avoid convulsions and trauma during ECT, electroconvulsive therapy. Used in severe case of tetanus and status epilepticus. Coming to the centrally acting. Used in acute muscle spasms, spastic neurological diseases, torticollis, lumbago, backache and neuralgias. Also used in treatment of tetanus and in orthopedic manipulations. Coming to the adverse effects, peripherally acting skeletal muscle relaxants cause respiratory paralysis and prolonged apnea, fall in BP, cardiovascular collapse, cardiac arrhythmias and malignant hyperthermia, especially caused by succinylcholine. Coming to the adverse effects of directly acting agents, dry mouth or xerostomia, drowsiness, hallucination, ataxia and tachycardia. If you like this video, please like, share and subscribe to our channel. Thank you.